Now, before we go straight into the condition and the particulars, I'd like to draw your attention to the image on the right. Age-related macular degeneration, just very briefly, relates to the central vision, which is in the macula. And so this is what we're going to explore here today. Now, for condition, we have a female who's 95 years old, diagnosed with age-related macular degeneration. She's had a serious deterioration in her visual acuity and her quality of life in the last 5 years, and cataract surgery replacing both lenses in 2006. Now, the diagnosis for macular degeneration was obtained by fluorescent angiograph to reveal what's going on with the retina and macula, and in this case, they found wet macular degeneration in the right eye and dry macular degeneration in the left eye. And her visual acuity was count fingers at 2 meters or 6 feet in her right eye and 20/70 in her left eye. For treatment, 8 treatments were done over a 2-month period. The total duration for each treatment was approximately 30 minutes. The treatment used was Neurology 14 and the 905 Delta Professional model was used. Along with this, a microcurrent protocol was used to treat depression. If you need any more details on that, please contact us. For results, she went for checkup 1 month after the treatments were completed, and at that time it was found that her visual acuity, and we'll start with the left eye, had improved, and the left eye, remember, was the one with dry macular degeneration. That had improved from the start of care, which was 20/70, at the checkup was now at 20/50. So if you look at the eye chart on the right, it moved 1 line down on the eye chart. And Dr. Pena said this is a very significant improvement in vision with no other ophthalmic treatment for age-related macular degeneration. And to give you some idea what that would be like to look at the eye chart with that level of vision, I just blurred out the picture. You can see what it would look like with 20/70. -1 means you could read 2 of those 3 letters. You'd miss 1 of them. And then at the checkup, you can see the next line down and you can make out 2 of them very clearly, and the other 2 are somewhat hard to make out. So in this case, this lady got 2 of the 4 letters on the next line down. And I put them side by each so you could see the difference, the change in the vision after 8 treatments over 2 months. Now let's go to the right eye, and this is the one with the wet macular degeneration. The same thing, 1 month after treatments were completed, she went back for a checkup, and you can see at the start of care, she could count fingers at 2 meters or 6 feet, while at the checkup, she could see 2400. Now, if you look at the eye chart, this isn't even registering on the eye chart. So what I did, I got a low vision chart so you could have a look. And you can see 2200 is down here where the lady in the picture has her hand held. And 2400 is what this patient of Dr. Pena's could now see at. If you look here at 6 feet, this is the same as 1333. You'd need enormous letters to see at 20 feet away. And then I did some blurring out of the pictures again so you could see at count fingers at 6 feet, she can't even make out what anything looks at 2400. And then with treatment, you get the change in vision, so now she can make out all the letters at that level. So there you have it, a case of age-related macular degeneration and delta treatment. Thank you very much, and a very special thank you to Dr. Pena. Dr. Pena specializes in ophthalmology. He practices cataract and refractive surgery and does a lot of public health and ophthalmology. In combination with this, he also does homeopathy and traditional Chinese medicine, and he includes microcurrent and coMra therapy in the treatment of ocular conditions. And he's published several books in Spanish on holistic health. We'll see you next time.